explain for a layman to understand, what have you created here?
Yes, so for her, we attempted severally in trying to get access to the internal jugular vein. So what happens is that before you can get access to that, you have to palpate for what we call the internal carotid artery. So when you get the blood vessel there, so that's more medicine. Like when you get the blood vessel there, you go lateral to it, then you can get the internal jugular vein. So the idea is to get into larger blood vessels. So when you look at the anatomy, the internal jugular vein connects directly through the aorta and all those stuff, the other larger blood vessels. Because the idea is that you are taking out all the patient's blood through this machine for it to be washed, then it gets in back. So we attempted getting it, but it was actually difficult because she's had a lot of attempts. So it appears it's fibrosed, as in there's a scar formation inside. So looking at it, it's difficult to.
The cause of, because for children during this, sometimes the tubes and you pass through, that's not the right tube for children.
In ideal situations, we are supposed to have a pediatric dialysis unit, or like machines for only pediatrics and then machines for adults. But here's not the case in this part of the world where we find ourselves. So what we are using are just.
Tamale Teaching Hospital, you don't have that?
No, we don't have a pediatric machine for dialyzing pediatric patients. So what we're doing is that we are using the machines for adults for the pediatrics as well. Now what happens is that we have a sieve as well, and these sieves and filters, usually we have sizes, and the machine picks an amount of blood at a time. So the best is, and the ideal is for us to get a dialysis machine for pediatrics where the filter sizes will be appropriate size filters for pediatrics as well. What we are using here is an adult size filter. So if the machine is picking more blood than it's supposed to pick, because these are kids, and of course their blood volume is not like that for adults, so it can lead to hypotension, as in patient can easily have very low BPs, because the amount of blood that will be taken out at a time will be a lot. In addition to that, like I was talking about the size of the catheters as well, it can also even rupture the vessel. Yes, please. And also it can also cause what we call disequilibrium syndrome. So as in, you would see that because the amount of blood that is taken is a lot, so what it means is that those electrolytes and other components of that makes the patient hemodynamically stable at a go will not be there. So what it means that you can see the patient will be on the machine and start having a seizure. The patient can start vomiting, start having tremors and rigors and what have you. Those are some of the challenges that our pediatric patients face by we using these adult size or adult machines for the hemodialysis.
It is painful, very painful. And when they are performing the procedure, I mostly pant for breath. And it's like I'm dying.
People to help us, because now we don't have money again for coming for dialysis. So now we are begging people to come to help us, to be coming to our dialysis every time.
So of late, we've been having pediatric cases that come with chronic kidney pathologies that need dialysis.
just at last year, we had more than 30 cases of kidney failure cases, both acute and chronic kidney disease. And a good number of them needed dialysis in order to keep them alive or to help the kidneys to be able to recover and work on its own. But at least if the service is available, you are able to convince them. And most of them, when you do the dialysis for them, 3 to 4 sessions, the kidneys are able to recover.